we're good.
Great. Well, thank you to everybody for joining us and welcome again. We're pleased to be joined today by Dr. Bill Berman from Denver Health, who will be talking about what's happening in our community with COVID, and obviously many of the concerns that we share with everyone around the rising cases of COVID. As you can see from our dashboard, all three of our indicators are red, which signals a critical look at what's going on in our community. To help curb the further spread of COVID, most of our students and staff in DPS are working remotely for the time being. We continue to offer instruction to our first, second, and our ECE first and second grade students who are continuing in person for those families who have selected in person. And we know that our youngest learners struggle the most with remote learning. In fact, today we've asked all of our central office employees, myself included, to support at schools. Today, my assignment is at Bryant Webster Elementary School. I was just on the playground with a first grade class during their recess break. And we know just how critical in-person instruction is, particularly for our youngest students. Our youngest students are our developing readers. In-person instruction is so important, particularly for our children who are in the very earliest stages of developing their literacy skills to get a solid foundation for their future learning. We also know that our youngest students are at a lower risk, and we know that based on the information from our health partners. We are also continuing to offer in-person instruction full-time for our students in our newcomer centers, in our special education center programs, and through our remote learning support centers that many of our schools are offering to students for reliable access to Wi-Fi and support from adults for families who need that additional support. Our goal is to bring back as many students as soon as possible for in-person instruction. And we know that that's going to be critically important for everybody in our community to embrace the challenge of helping drive the COVID numbers back down. And that it is not simply the school district that needs to embrace this challenge, but really all of us in following the public health orders to help make sure our kids can get back in school quickly. I want to talk a little bit about the election. We know that the results of today's presidential and state elections may have a significant impact on our students, their families, and our staff. Students and adults have been experiencing a lot of additional stress this year because of the global pandemic and the racial unrest that we've seen. We definitely know that people are feeling anxiety about this election and that it can cause feelings of uncertainty. Because we believe deeply in being a trauma-informed district, we really want to emphasize the importance of social-emotional wellness in our school community. We want to ensure that our staff, our students, and our family are supported during this time. We have committed to being a safe and welcoming school district for all of our students, their families, and we have provided resources for talking with students after the election, particularly resources for our Black, Indigenous, and students of color, as well as social and emotional supports and resources available for all of Team DPS. And so at this point, I'm going to turn it over to Dr. Bill Berman to share a little bit more about the health conditions in our community right now.
Superintendent Cordova, it's Bill Berman from Denver Health. As I think probably all of you are aware, COVID continues to increase in Denver County, around the metro area, and in our state, and indeed in the surrounding states as well. And so we are not an exception to any of those trends. So the case rate, the hospitalizations, and the percent of tests that are positive, those are all key metrics, are all increasing. I will say, on the other hand, that the experience in DPS and in other school districts in the metro area is that even at a time of high-level transmission in the community, there appears to be very little transmission within the schools. And I think that's not just a finding from the Denver metro area, it's being replicated around the country. So we think it still is possible for schools to be safe places at a time when COVID is very active in our community. So that's a high-level summary, and I'm happy to take questions about any details.
All right, our first question is from Jenny at CPR. Go ahead, Jenny.
Yes, thanks. I'm just trying to understand the governor's latest health thing, putting in-person learning in the critical businesses section. And I'm just wondering if this changes how you do things now? And if COVID rates continue to rise, how do you feel about this, or would you have liked more state guidance? I'm just trying to understand if this is significant or not.
Yeah, so thanks, Jenny. I think it's a really important question. Let me speak a little bit from my lens, and then would love to allow Dr. Berman to just share how, from the medical field, we are all working to understand and grapple with both our state guidance, what we are learning about COVID, and how we can think about supporting what I 100% agree with is the critical business of educating our youth. You know, what has been really challenging is as we look, you know, not just in the state of Colorado, but across the nation, there really hasn't been a common set of sort of a rule book around how to approach keeping schools open. And, you know, definitely I think it's important in a state like Colorado, where we do have very different kinds of communities, that we have approaches that allow for the differences across communities. And at the same time, I think as there is a growing body of information, really will be helpful to school districts to have more common guidance around how to operate school safety. So I very deeply appreciate the partnership that we had both with our mayor and with the governor. And I think in addition to that partnership, having more clarity around safely operating schools would be incredibly beneficial to all of us as school district leaders.
Thanks, Susanna. I didn't see the governor's statement, so I don't know any details about it. I think it is part of this growing recognition that schools can be a safe place for kids and for staff, even in the setting of very active community transmission. I don't know that this is going to change our recommendations or guidance at this moment, but I think it is part of this growing nationwide recognition.
Thanks. Teeny with the Denver Post. Go ahead, Teeny.
Sure. Thank you guys for being available this morning. Last week, parents protested the closing of in-person learning for older elementary students. Is there any intention to change the learning format for 3rd through 5th graders in the immediate future? And if not, what would it take to bring them back into class?
Yeah, so thank you. You know, I want to say first and foremost how critically important I think it is for us to be able to bring our students back in for in-person learning. We do need to see at least at the very minimum a flattening of what's happening with our COVID numbers in our community to be able to bring back our students. We really want to stress it is not our concerns around people getting COVID in school, but really the concerns around disruptions and interrupting learning in person with frequent quarantines that guided this decision. And I think as we begin to see the COVID numbers drop, and frankly, as we begin to see more information about COVID within our schools, we'll be in a better position to make decisions like that.
Thanks. David from Denver North Star. Go ahead, David.
Thank you. And yes, thank you for being available this morning. Another follow-up on the protests. We're starting to see more families in Northwest Denver talking about or actively pulling their students out of DPS for private schools or neighboring districts where they can do in-person learning. And I was just wondering if you had any thoughts on that.
Yeah, so thank you. You know, I think it is really important for DPS to, you know, both listen to our constituents. We want to be able to serve all of our students and serve them exceedingly well. And I think it's also really important for all of Denver to embrace the responsibility that we have to ensure that we can offer instruction in person to our students. You know, I live in North Denver, so I'm very aware of what's happening in North Denver. And I just have to say, like, I live very close to Sloan's Lake. The number of people that I see who are still outside in large groups, not wearing masks, engaging in activities outside is part of what I believe is creating the conditions that are impeding our ability to bring all kids together. And I know everybody is getting tired and, you know, we all have pandemic fatigue, but it really is on all of us. If we want our schools to be able to operate, if we want to be able to focus on having in-person instruction for our students, it really is on all of us to make sure that we are continuing to do our part to help drive these numbers down.
If I could just add that we all need to recognize that COVID when I quote these overall numbers, those are not equally distributed across our community. So there are large and persistent differences in the risks of COVID among all age groups in different neighborhoods in Denver, and DPS is committed to treating its schools equally. And that's a challenge when you have very different rates of COVID around the city.
Thank you.
Erica at Shakopee, go ahead, Erica.
Yeah, thank you. We have had a lot of questions come into us, and I'm sure you've seen this reflected in the parent emails that you receive as well, asking what the role of DCTA has been in the decision to maintain more students remote versus the health concerns. And I was hoping that you could speak to that. And then just wanted to follow up a little bit on some of the previous questions. In terms of what would we need to see if the numbers remain high, are we remote for the rest of the school year? What do we need to see in order to bring students back?
Yeah, so thank you. So let me talk about how we've approached decision making. We have had a group of leaders from the district, and we've worked really closely with Dr. Berman, with Dr. Steve Federico, who has been on our press briefings in the past, who's a pediatrician with Denver Health, with the Denver Department of Public Health and the Environment. We definitely have asked our parents for input and feedback, and want to be really clear. You know, our parents do not speak with one unified voice on what they believe is the right thing to do. We have many, many parents who believe that we should be in person, and many, many, many parents who believe that we should not be in person. When it comes to the role of the DCTA participates in these meetings. We do think it's really important that we are paying attention to the needs of our staff. And I can assure you that there are members of the DCTA who believe that we should not be offering any in-person learning at all, as well as members of the DCTA who are coming into work and who very, very much want to be a part of offering in-person instruction at all grade levels. We really have tried to use the guidance around the local conditions, our beliefs and values as a district, the importance of having schooling that can continue with continuity. And you know, Dr. Berman has been really helpful in helping us think about when there are frequent disruptions, not only is it an interruption to our students' schooling, but the disruptions really can take our eyes off of the really important focus that we need to have on ensuring that the protocols and the practices to keep schools healthy, safe, we can get distracted from that. And so that really is how we've been approaching the decision making. So certainly the DCTA is part of that group, but I would not in any way say that they've swayed our decisions in one way or the other.
Jenny from CPR, go ahead, Jenny.
Yes, I just wondered if the call to log out of school yesterday had any measurable impact on your attendance numbers.
Yeah, so thank you. So when we looked at attendance for yesterday, it generally looked pretty similar to where it had been. In fact, we saw a little bit of an increase in attendance yesterday over the previous Friday.
Thank you.
Janet with 9 News, go ahead, Janet.
Hi there. I am just curious, given that, you know, the students in grades 3 through 5 were just brought back, and it was at a time when COVID cases were on the rise, do you regret bringing them back at that time only to switch them back to remote 2 weeks later?
Yeah, so thank you. Actually, I don't regret it. I think it is really important that when we can offer in person, we do. It will definitely help. You know, my fervent hope is that we're able to start bringing our students back in again. We will have had the opportunity kind of learn those new protocols, which will be very beneficial for our students, particularly for our elementary school students. I know how hard it is for our younger students to not be in school. It's hard for everybody. I just want to acknowledge that. And I've heard from many parents of older students who are also really anxious to get their kids back in school, and so want to acknowledge that. But particularly for our elementary school students, I think it is really important that when we can offer in person that we do.
Thanks. Erica with Chaffee. Go ahead, Erica.
Yes, I appreciate the thorough answer to the previous question. I had sort of a second question about what it would take to bring kids back into the
Oh yeah,
classroom.
sorry.
No, that's okay. No, that's okay.
Yeah,
And I guess, and just to kind of put a little bit of a finer point on that, in particular with the elementary students, you're looking at that post-Thanksgiving break period. And of course, everyone is concerned about what will happen to cases if people gather with over the holiday. And so can you or Dr. Berman talk about sort of what are you looking for to say, okay, these are conditions that allow us to come back?
Yeah, Susan, I'm happy to start have some initial thoughts on that. We developed this dashboard back in July, was it? Or August. We chose metrics and thresholds at that time based on what other big city school districts were suggesting, what some sets of national guidelines had. I think what we've learned since then is that there is less risk of transmission within schools than had been expected when the basics are followed. And so Dr. Federico and I are rethinking, along with others, now with that additional knowledge, what should a dashboard of metrics look like? We're not trying to move the goalposts. We're trying to update guidelines based on developing knowledge. And so, as Susanna mentioned, I think to extend schooling at a time when case rates are not just high, but increasing is difficult. So I think stabilization in key metrics like case rate, like hospitalization would be great. But we are actively re-examining that question based on the data locally and nationally.
Erica, if I could also just add to that, I do think it's also going to be really important. I very much have appreciated both the governor's and the mayor's focus and attention on extending health orders that will help us reopen our schools. And so as we see things like limitations on the size of gatherings, public use of masks, and enforcement around things like that, that will help us. And so anything that we can do as a community to acknowledge the critical importance of in-person schooling, particularly for our youngest learners, through adherence to those public health orders is absolutely going to help us. And so I believe deeply that as we begin to see more, either more public health orders or people following those public health orders, the higher degree of fidelity, the faster we're going to be able to get our kids back in school.
Okay, I think that's a wrap for today. Thanks, everyone. We'll see you back here next week.
Bye.